Recorded Medication Teaching, an initiative of the Manitoba ACS Network and St. Boniface Hospital. Antiplatelets, ASA and Clopidogrel. Platelets are cells in the blood that form clots by acting as a kind of glue, causing the blood to become sticky. They normally work to form blood clots when the lining of the blood vessel is broken. This is how they help stop bleeding. However, platelets can also cause clots to form when they touch something that should not be in a blood vessel, like a cholesterol deposit, also called plaque, or a metal stent. Most heart attacks start when a cholesterol deposit, or plaque, in a blood vessel has broken open. This causes platelets that are near this broken plaque to become sticky and cover the broken plaque. As the platelets build up, they can block blood flow to the heart muscle, resulting in damage. This is how most heart attacks happen. Antiplatelet medications, including ASA or aspirin and Clopidogrel or Plavix, make your blood less sticky by making platelets less active. This can keep blood flowing through a blood vessel even when a plaque is broken open or when a stent has been placed in the vessel. Antiplatelet medications are very effective to prevent and treat heart attacks. It's best to take your antiplatelet medications at the same time every day. You can take ASA and Clopidogrel together, with or without food, although food may lower the risk of upset stomach. Do not stop taking your antiplatelet medications unless directed by your heart doctor. Stopping antiplatelet medications on your own can lead to heart attacks. Since antiplatelet medications affect clotting, bleeding can happen. Most bleeding caused by antiplatelet medications is minor and not dangerous. This is called nuisance bleeding. For example, cuts may take longer than usual to stop bleeding. You may notice that you bruise more easily or get nosebleeds more often, and they may take longer to stop. More serious bleeding is rare. Serious bleeding may include blood in the urine, coughing up or throwing up blood, bloody or black tarry stools or poop, or bleeding that does not stop. Get medical attention right away if you have serious bleeding. Many drugs can cause a rash. A rash may develop in about 1 in 100 people who take Clopidogrel. This usually starts after taking Clopidogrel for several days, as itchy red or pink areas on the chest and back that may worsen and spread to the arms and legs. Get medical attention at the first sign of rash after starting Clopidogrel or any new drug. Rash caused by Clopidogrel can either be treated without stopping the drug, or you may be switched to another drug that is not likely to cause a rash. Do not stop taking Clopidogrel on your own. Make sure all of your healthcare providers, including nurses, doctors, dentists, and pharmacists, know that you take antiplatelet medications. In some cases, you may have to stop taking antiplatelet medications before some medical procedures, surgeries, or dental procedures, but only if this has been approved by your heart doctor. People who take antiplatelet medications should usually avoid taking anti-inflammatory pain medications, such as higher dose ASA or aspirin, ibuprofen, also known as Advil or Motrin, and naproxen, also known as Aleve. Acetaminophen, or Tylenol, does not cause bleeding and is a safer choice if you have pain. Talk to your pharmacist or other healthcare provider before starting any new medications, vitamins, herbal products, or supplements to ensure they will not interact with your antiplatelet medications. If you have any questions, talk to your pharmacist or other healthcare provider. Visit the Manitoba ACS Network website at www.mbacsnetwork.ca